Hey you guys, and welcome to the third episode of The Heart. The previous video we covered how to read and understand the ECG. Mastering the ECG will help you to visualize the flow of blood through the different chambers in the heart, which is very helpful when you're going to find different heart-related malfunctions later in your studies. So if you haven't seen the previous video, please do. So for today's topic, we're going to talk about arrhythmia. One of 5 vital signs a physician checks when you go to the hospital is your pulse rate. A normal heart rate lies between 60 beats per minute and 100 beats per minute. In some cases, an abnormal heart rhythm can be detected, which is called arrhythmia. Arrhythmia means that your heart beats too quickly, too slowly, or within an irregular pattern. When the heart beats faster than normal, which is more than 100 beats per minute, it is called tachycardia. When the heart beats too slowly, which is less than 60 beats per minute, it is called bradycardia. The most common type of arrhythmia is atrial fibrillation, which is caused by an irregular and fast heartbeat. Many factors can affect your heart's rhythm, such as having a heart attack, smoking, congenital heart defects, and stress. Hormones released into the bloodstream by the sympathetic division releases epinephrine, norepinephrine, and thyroid hormones, which also influences the heart rate. The most common causes to arrhythmia are a heart disorder, particularly coronary artery disease or CAD, which cause the blood supply to the muscle to be partially or completely blocked, or heart valve disorders, and heart failure can interfere with the rhythm of the heart. The types of arrhythmia, and so how you identify arrhythmia can be done by detecting where they originate in the heart and whether they can cause the heart to beat slow or fast. So arrhythmias that start in the atria are called atrial or supraventricular arrhythmias, and supraventricular means above the ventricles. Then we have rapid heart rhythms originating in the atria, including atrial fibrillation, atrial flutter, and supraventricular tachycardia. Arrhythmias that start in the ventricles include ventricular tachycardia and ventricular fibrillation. These are serious, often life-threatening arrhythmias since the ventricles do most of the pumping. Ventricular fibrillation is the most common cause of sudden cardiac arrest, or SCA, and is fatal if not treated within a few minutes. And then we have slow heart rhythms, which occur when the heart's normal pacemaker fails or when there is a conduction block within the conduction pathway. So, arrhythmias can be hard to diagnose, especially the types that only cause symptoms every once in a while. Doctors diagnose arrhythmias based on medical and family histories, a physical examination, and the results from tests and procedures. These typically include blood tests, a chest x-ray, an ECG, and echocardiogram that uses sound waves to create a moving picture of your heart. And sometimes it's necessary to apply heart monitoring or to be worn for a specific period of time to detect intermittent arrhythmias. And an invasive procedure called electrophysiology study is sometimes performed to assess the conduction system of the heart. So that was a brief introduction to arrhythmia. Thank you guys so much for watching. Please do give us some feedback so we can improve. And if you guys have any requests, please let us know in the comment section below. Thank you guys. See you later.